Up first this evening, an investigation has been launched into the circumstances which led to the death of a pregnant woman who was denied medical treatment at University and Victoria Jubilee hospitals. The woman was showing symptoms similar to those displayed by patients with COVID-19. Now, the doctor who provided care for the woman has said that tests undertaken have confirmed that she did not have COVID-19. The Prime Minister and his Health Minister are looking into the matter, while the opposition spokesman on health has also called for a review of the COVID-19 readiness of hospitals. Our reporter Kirk Wright, who broke the story on Friday, has this primetime news follow-up.
Dr. Lloyd Golson, the physician of the deceased woman Jodian Ferron, is advocating for immediate changes to the healthcare protocol to prevent any other patient from being denied medical care at any health facility. His comments came against the background that the now deceased Jodian Ferron, who displayed COVID-19 symptoms, was denied acceptance at the University and Victoria Jubilee hospitals after several attempts by her doctor to transfer her from the Andrews Memorial Hospital.
Well, a policy definitely have to be in place that when we have patients like this, that there somewhere that these patients could go. Andrews are saying that they don't have the facilities to do the tests, and whenever they try to do something about it, the doctors are moving away from Andrews, and they might be going to not all, but I think a policy should be there that patients can be delivered both at Andrews and not all hospital.
The Prime Minister, Andrew Holness, has also expressed concern about the death of Jodian Ferron in a statement released to the media on Sunday. The Prime Minister says he has been informed by the Health Minister, Dr. Christopher Tufton, that a thorough investigation of the matter has been undertaken, including a review of all established protocol in and between the public and private healthcare systems to identify any possible general system weaknesses or specific operational breakdowns in the handling of this case. Now, since we broke the news on Friday that the University and the Victoria Jubilee hospitals denied medical care to a pregnant woman who has subsequently died, reports have also surfaced that the Andrews Memorial Hospital was turning her out. Now, her physician, Dr. Lloyd Golson, has come out to say that's not exactly true.
Andrews did not send away the patient. The patient came to me with pregnancy-induced hypertension, and I decided to deliver her at 37 weeks. And she, at the time, I didn't think she had COVID, and she came through, she passed the test and was entered in Andrews. But while she was there, she developed a fever, and everybody panicked that she could be COVID, and they said that she coughed in the room. A patient beside her got very nervous, and pandemonium. Andrews wanted her to go up to a place where, in case anything happened, she could be monitored better.
The Health Minister says he regrets Jodian Ferron's passing, but stands ready to assist the family.
We will give whatever support is necessary to the newborn child, who I understand is stable and in hospital, and whatever counseling support we need to give to other family members.
The opposition spokesman on health, Dr. Maurice Guy, is also speaking out about reports that came from a senior person at the Victoria Jubilee Hospital on Thursday that the hospital was awaiting COVID-19 test results that were done over a week.
At the same time, we have the Cabinet of Jamaica testing on the 17th, and 3 days later they had back their results. The frontline staff in all hospitals are the ones who interface daily with COVID-positive cases. So it is unacceptable that we can treat with some amount of urgency some results, and those that are attributable to our frontline workers, we treat them without any urgency.
He also raised concern that when Ms. Ferron was taken to the Spanish Town Hospital, she had to wait for over an hour before she was moved into the hospital.
We have been told that hospitals have been prepared. We have been told that all hospitals across this country have been prepared to have COVID patients coming in. Now, it cannot be that Spanish Town Hospital, the largest Type B hospital in the country, was not in a position to accept this patient, and she had to be sitting in the ambulance or lying in the ambulance for a considerable period before they could find space to accommodate her.
Kirk Wright, TVJ News.
And Andrews Memorial Hospital has issued a statement telling its side of the story. It says Ms. Ferron was admitted to the hospital on Thursday to deliver her baby and started to show symptoms of COVID-19, including cough, fever, and a shortness of breath. The hospital says concerns were raised about the safety of the patient and her baby because Andrews is not equipped with a functional intensive care unit ICU to provide respiratory support and isolation facilities on the maternity unit. Andrews says it contacted the University Hospital and Victoria Jubilee Hospital about transferring the patient, but they refused to accept her. It says a plan was put in place to manage the patient by her physician. According to Andrews, on Friday morning, her doctor recommended an urgent C-section. The hospital notes that her physician's team of independent anesthesiologists refused to participate in the surgery. As a result of this, Andrews says the nearest hospital with the required facility, the University Hospital and Victoria Jubilee, were contacted and again both refused to accept the patient. Andrews says the patient was eventually transferred to the Spanish Town Hospital where she delivered her baby after collaboration with the National Emergency Operations Center. The hospital says after delivering her baby, Ms. Ferron was transferred to the University Hospital where she died.